So I want to start off by saying that advocacy is one of the most important things that we could do as caregivers. And yet most caregivers don't even realize the power of their voice early enough. Mm-hmm. And if there's one thing that I hear all the time is that they realize that the way they advocate and the fact that they can advocate comes way too late, almost too late to the point where it's only in hindsight. And so I think what I'm really excited about with this episode, and especially with Allison here, is that if there's one thing to take away from people that have gone through this, it's the power of your voice. It's the power that you can advocate. And we'll break it down because I know some of you who are listening may say, what does that even mean? And what do we do? Mm-hmm. Well, Allison and her journey, she will break it down with you just by the way she has learned to live and to care for the people in her life. And so I'm like, get your coffee, turn up the volume, because this is an episode that is going to really make a difference in how you care. So Allison, thank you so much for being here. I have to tell everybody that you and I go, I guess, way back. And you've been just such an encouragement in my life, an inspiration in my life. You've been a caregiver so long. I want you to give everybody kind of an overview of who you are, your story, and it's a continued story that you're living out right now. Yeah. But welcome to
Thank you.
The podcast.
Thank you. Oh my goodness.
And thank you for all
so
that you
excited
do.
to be here.
Yeah.
Thank you. I'm so excited to be here, and spending time with you is my favorite. And so, if we get to do that and other people just happen to get to listen, it's a bonus. I'm just really, really happy to be here today. Thanks for asking me. So I'm Allison Breininger, and I am a caregiver for my husband, Sean. So he, 11 years ago, when he was 31, was diagnosed with a rare genetic disease called Fanconi anemia. And that disease causes bone marrow failure, and it also causes cancers at a rate of around 750 times that of the rest of us. And it's rare, so we had never heard of this. And so he got this diagnosis out of nowhere and then went almost immediately to bone marrow transplant, which in my eyes is really one of the hardest things a body can do, because they bring you basically to death so that they can put in those new cells and bring you back. So he did that right away. And then in the 10 years since, he has had cancer of the tongue, where they removed half of his tongue, cancer of the bladder, where they removed his bladder, cancer of the throat twice, and he's had chemo and radiation, cancer of the gums, of the lips, and about 150 skin cancers. So our life is just a continuous, we're always on watch. We're always doing scopes and scans and labs and just looking to try to find the next cancer when it's tiny so that we can get rid of it, because we know it's coming. And so that has been my reality for the last 11 years, is just as a young married person, young mom, all of a sudden being a caregiver to a person with a rare disease.
Wow, I know. And everyone should literally go to our website, and we have a video of Allison's story. You have to watch that because you'll see a glimpse visually of all that she's sharing. When you say you were a young mom and you were a young caregiver, how old were you? And the timing of being a parent and everything.
So we were actually high school sweethearts. So we had been married. I know. So we had been married for 8-9 years at this time. We had just adopted our daughter Maya from Haiti. So she had just finally come home to us, and she was a toddler. And so we had 1 year with Maya before weird symptoms started happening, and then spent a year trying to find a diagnosis and all of this. So I think I was around 30 at the time.
Wow.
So we have sort of this pre-post life, right? We have times in our life when it was sort of like just us as a little married couple and as a little family. And then we have sort of the post-diagnosis, which is the rest of our lives. And we know that there is no cure for this disease. And so we know that the rest of his life, that's what this will look like for us.
And I have to do a shout out that you have to follow Allison on Instagram, and we'll link everything up because she shares all of this with such authenticity and just realness that is going to resonate with all of you. There's so many things that we can talk about. I mean, everything that you mentioned, because as you were saying, and the reason why I want to have you share about other aspects of your life of being a new mom is you have so many roles, right? You're caring for so many people. And so we could talk about marriage, we could talk about being a parent, a new mom, all of that. But I really do want to focus today on being an advocate. And from everything that you have gone through and are going through, I would love to hear your journey of finding that voice. Like, where did you start? Did you always know that you had this voice and that you had to stand up, or was there a progression? And before you go into that, I think it's, I love the meaning of words, and it was fascinating even preparing for this conversation that the word advocate, means to plead on someone's behalf. Yeah. Plead, like that word plead is fascinating because it's not just asking, it's not just doing the logistics, it's not just saying, okay, I'll follow instructions. When you plead on someone's behalf, that comes with conviction, that comes with knowledge. It's like, it's strong, like you're persuading someone. So like, what was your journey? Tell us about your journey.
Yeah, for sure. I just want to add that I hear the word desperation. I think of desperation. When you hear the word plead, you don't just casually plead.
Yes.
You know what I mean?
Yes.
It feels like when you are pleading that there's a layer of desperation there.
Right.
With that word.
Point. Yeah.
So when the first thing I said, the first thing that happened with him was that bone marrow transplant, and they actually had me sign a contract to be his caregiver because it is so intense that they do not let a person have a bone marrow transplant unless they have a person has signed a contract saying that they will be with them 24/7 for 100 days.
Interesting. I never knew that.
Yes. So like where some people are like, I didn't know I was a caregiver. I knew right away because I had to sign a contract.
Wow.
And so I reference that because in the contract, and of course they can't spell out all the things, right, that are going to happen, but they talk about a lot of medical things, like you're going to, organize their meds and get them to appointments. And they talked a little bit about some emotional pieces. So there was sort of a little bit of a job description in a way that I was handed right away. But the word advocate was not in that. And I wonder if part of that is because the medical people probably don't see that, because often in that space, I had to advocate, with them. I had to, fight against the medical system. So they probably don't think to put that in their contract.
Interesting.
As something that they think that I'm going to have to do.
That's an interesting dynamic. You're right. You're like, they're not going to put that in because it's usually you're advocating, I guess, with them, like against them, not against them, but like.
I know I can't think of the adjective, but yes,
they're
exactly.
the recipient of your advocacy.
Yes. So that was a piece I didn't know. I didn't realize going in.
Yeah.
But I can clearly remember, so his transplant was over Christmas. And, I remember it was a Christmas Eve and he was sick as a dog. And he was literally delirious. Like he was having hallucinations. And everybody else was gone. It was just me sitting there and, it was Christmas Eve. So we had sort of like the C team. We did not have our normal nurses. We had the people who were like showing up because nobody else was there. And I remember like asking this nurse, like, is this okay? Like, is it okay that he is like, he is seeing people who are not in this room? Like he is clearly hallucinating. And she kept blowing me off. And I just thought, well, she's the nurse but this doesn't feel right. And so in the morning when, our team came back, I mentioned this to a nurse and they said, you don't ever have to have a nurse that you don't want. You can, at any moment, you can ask for the head nurse or walk to the nurse's station, ask for the charge nurse and say that you want a new person. And I was like, what?
Right.
Like nobody had told me that.
Right.
Nobody, and you think about it, like, I guess technically we are like the customer.
Yeah.
Right.
Yeah.
Totally. And we can ask for those things, but nobody had ever told me that. And I never knew that was even an option.
Right.
So I feel like that was a turning point moment for me of someone saying, oh no, you don't have to just settle for whatever this is. Right. So that was like, I think the first moment that I remember doing it. And then there have been, 10 million moments since, but I think that person just sort of mapping out for me what that could look like was very eye-opening for me in that moment.
Right. you touched upon a couple of things. It's so interesting. It's like, what do you feel versus what do you know? And most caregivers are not trained. We're not trained. So we go into this hospital system. A lot of it is medically driven. You're like, I don't know what I'm doing. What am I to say that I'm going to tell you to do it this way versus that way?
Yeah.
Right. And so I think that's the big gap. So as you were going through it, how did you know the difference between what you feel is off, but how do you then say with confidence that this is off?
Right.
Like, how did you deal with that? Or did you just say like, oh, I'm just gonna.
Right. Yeah. Good question. I think that I could, because there were certainly moments where it's like, I could tell he was in pain and maybe they weren't taking it seriously. Or they were saying, I think this is the diagnosis or the treatment plan, and I could tell that's not enough. Or even moments where they would say, oh, our next available appointment is 6 months from now. You know, moments like that where in my gut, I could tell, like, that's not good enough. Like, this answer is not good enough.
Right.
And so I remember at one point he had some kind of infection and they kept trying different things, but after a while they're like, I don't know. And I was like, that is not good enough.
Right.
Like, we cannot just shrug our shoulders. Like, we have to keep asking. We have to keep looking for an answer. And I remember the physician's assistant in that moment, because I was just like digging and just saying like, look, what's next? What's next? What's next? And I think I started to apologize, you know, of just like, I'm sorry. And like, I still need you to keep doing this. And I remember her saying to me, she looked a little deflated because I think she didn't know what to do next, first of all. But she looked at me and she said, if I was sick, you were exactly the kind of person that I would want taking care of me.
Powerful.
Yes. So she was able to take herself out of like, she didn't really like me as a patient caregiver right in that moment because I was being a pain.
Yep.
But she was able to acknowledge that what I was doing was important, and it's exactly what she would have wanted if she had been in that hospital bed. And so I cling on to that to be like, okay, all right, I can be a pain. It's fine. My mom used to joke that at the whole University of Minnesota like hospital system, that there's a little picture of me on people's like desktops, computers that says like, watch out for this one.
Good thing
Don't
you're like
mess
the
with this
sweetest,
one.
most awesome, most fun person. So watch out for her, but she's also someone you definitely want to hang out with. But
don't mess with her.
Yeah.
But on a good day, she's great. But don't mess with her or her husband, you know?
I mean, that is so critical. It's almost like that nurse or those nurses that told you those things gave you this permission that you didn't know you had. Right.
Yes.
And hopefully you are giving all of our listeners permission right now to do the same and to voice what you think is off and know it's off. And then I think the other aspect of it is, you know, I remember talking to a couple of doctors and I would apologize. We would apologize. Oh, I'm so sorry. I'm bothering you. You're so busy. And this one doctor's response was, I'm actually really grateful that you are pushing this forward because things can get lost. And for me, that was the moment of like, what? Things get lost in your highly documented healthcare system? I am needed. I need to push this through. Yeah.
Yes. Just yesterday we had an appointment with one of Sean's providers and I said, do you know what's up with this whole like immunocompromised people being able to get a fourth shot? And he was like, well, I don't know. And then he said, he's like, well, I know that they looked at the lung transplant people first and then the people who recently had a BMT, a bone marrow transplant, next. And he said, I bet nobody's thinking about Sean. I bet he's not on anybody's radar. And sort of like you just said, like things can get lost. I was like, what?
Right.
So if I don't bring up this question, nobody's going to bring this to us?
Yeah.
What?
Yes. Right.
You know, so it's moments like that. And so I want to acknowledge that the yes and here of you're saying you can find your voice. And I also want to acknowledge like, oh, we are tired.
Yeah.
Right. We're tired as caregivers. And so to say like to for me yesterday to think I have to ask all the questions. I have to bring all the things up. Like, nobody's going to reach out and say, did you know there's this new thing that you might be eligible for, Sean? Like I have to do that feels like it's another thing. It's another thing.
Yeah, that is such...
And another thing I'm not trained for.
Yes. It's another tension that, you're exactly right. Like, we're empowering you to use your voice, but now it's like, it's all on you. You better ask that.
Right.
And if you don't, they're going to get lost in the system.
Yes.
Oh, that is not the pressure that we want to put on everybody. I mean, there's truth to it. But so then how do you, and I know that you are a professional speaker. You talk about self-care. You talk about this dynamic. Yeah. So how do you deal with that tension?
Mm-hmm. It's a good question. I think I have to find that balance, right? I have to say, like, okay, these are the things that I know that I can be asking for. Some of them are more easy. If it's like if we're sitting there in an appointment, I can see that he's shivering. Nobody else sees it. And I say, we could use some warm blankets. Or it looks like he's in pain and needs more numbing medication. Partly this is my husband is the sweetest person you'll ever encounter. And so part of it is that he very rarely will be the one to say, I'm cold. I could use a blanket, right? And so partly I have to be that extra set of eyes to be able to ask for those things. Or, especially back in the day when he was even more immune compromised, seeing people like drop something on the floor and then like they were about to go then like inject that into him. And I'd be like, oh, no.
I saw that.
Can't happen. Yep. Yeah. So I think there's some things like that. I think in the moment it's like, yes, you have. So like when I would see those things, I think that the claiming your voice is to not feel bad in that moment, to say, nope, we're going to need a new syringe.
Right.
Because we're sitting there anyway. And so to not feel like I just have to sit here and be like, oh, is that syringe about to inject, floor dust into him or whatever, Right. But I think the place where I have to sort of give myself permission is things like yesterday with the shot. I can't think of all the things. I can't. There are, I cannot sit here imagining all of the questions I could be asking that maybe someone else isn't thinking of.
Right.
I just only have so much capacity. And so as something comes up, like the fourth shot, I can bring that up. But I have to give myself permission to not feel like I have to like read all the research and read all the articles and read all the everything every minute so that I can advocate in that way.
Yeah.
Does that make sense?
Absolutely. I think that's a huge point where you have the power of your voice, but you don't need to feel like you are literally guiding and navigating the entire care, because that's too much. I mean, we can't do that. But if we can just voice what we see or what we know, we feel, like that's enough. So it's almost like you don't need to prep for this test, just keep your eyes, ears, heart open and just voice what you see and hear and feel. And then I like that. That's freeing for me to hear right now,
Oh, good.
Yeah.
Good.
I mean, have you, when we think about advocacy, sometimes what comes to mind is, when do you advocate? What aspects? We talk about clinical care. Yeah. I know there are financial aspects.
Oh my gosh. Yeah.
Insurance aspects, with friends, family. It's not just in the hospital. So can you share a little bit about that in other areas of the care journey?
For sure. I mean, I think the finance, legal, insurance, Medicare. Oh my goodness. I mean, it makes me want to take a nap just even saying those words, because it's so hard, and the system is broken. And so I think that's something to just sort of put out there, is that you're dealing as a caregiver with a broken system. You are going to get bills that are incorrect, and you just have to know that that's going to happen. And we have had multiple times that I have taken the energy to call the person to say, what is this bill? And they say, oh, sorry. Yeah, you shouldn't have gotten that. You can just throw that away. Oh my God. And I think if I was just a bill paying citizen, I would have just paid it and nobody would have ever known.
Oh my gosh.
Right.
That's crazy.
Or Medicare. Like we've had all this, we went through a whole thing earlier last year about Medicare denials and then all these things and making decisions about if Medicare's not going to cover it, and then how much do we fight? And people are like, you need to contact Congress, and then I think part of this with the advocacy turns into, what is the worth of your person? So we had to make decisions about, if Medicare's not going to cover it, how much do we pay out of pocket for these medical supplies? And my husband went through a whole moment of am I worth that? Am I worth those hundreds and hundreds of dollars a day that Medicare is saying they're not going to cover. And therefore it's this moment of worth. And I think that comes up a lot in this advocacy piece. So I want to say loud and clear that your person is worth it.
Yeah.
So they are worth the angst you might feel by saying to the person, like, we're going to need a new syringe because you just dropped it on the floor. They're worth it, because what you don't want to have happen is them to get some infection or some whatever, just because you felt a little nervous in that moment about sticking up for them. They're worth it for when you have to, when the person says the next appointment's 6 months away and you have to say, that's not good enough. I need to talk to a supervisor. Like, that doesn't feel good to have to do that, but your person is worth it. They are worth the money that the government or Medicare, whoever is saying, like, well, if you want to keep doing this, that costs that much money. They are worth the fight to figure that out.
Yeah.
And I think that can feel, we can lose that sometimes. We can start to question that both the patient and the caregiver in these moments when systems are trying to say, like, maybe they're not worth it. Maybe they're not worth our A game. Maybe they're not worth us doing accurate billing. Maybe they're not worth us covering your supplies.
Yeah.
So I just want that to come through loud and clear. I don't want to say that in a way that makes there more pressure, but just for you to know that they are worth it. And that's why we advocate.
Yep. That's a good guiding phrase to think in the moment, because it can be awkward, and you can be shy, and you don't want to make the clinicians or anybody or the insurance company, or I don't know, there's always this fear that, you're going to make it worse for your situation, because you're going to be annoying or frustrating, or I don't know, they just don't want to answer your question or something like that. But they are worth it to push through it. Yeah.
Yeah. Yeah.
So
like we had this whole Medicare thing a few months ago, and actually it was with the help of an Ionicare navigator.
Awesome.
Who helped me, because I know a lot of things. Like, I've been doing this a long time. I call myself like a caregiver ninja at this point.
You are.
I can do a lot of things. I still don't understand, or nobody ever will, how Medicare works. Right. But I was able to, like, sit with one of your navigators, and in like 20 minutes, she was like, here's the thing, here's the thing, here's the thing. And so I think that's part of it too, is that we don't always have to advocate ourselves. Like, I don't have to become a Medicare expert.
Right.
I don't, and I can't. But advocating can also mean bringing in resources.
Right.
It can mean going to that expert and saying, help me figure this out. So it doesn't have to feel, I feel like sometimes advocate can feel like a really singular, like, I'm going to be the one to do it all. And it doesn't have to. It just maybe means you're the organizing force.
Yes.
Yeah.
I think that brings down that pressure. You know what I mean? Yeah, because you're right. Advocate, even that word, you typically see it in professional settings. And if they're the advocate, it's almost like they know so much about it. They're the one speaking in front of thousands of people, or writing that big op-ed because they're the advocate. No, it's just like, you can be the organizer. You can be the rallier. Where, in your experience, has your voice or your advocacy actually changed the care plan? Like, has that ever happened?
Good question. Let me think for a second, because I know it has.
Yeah.
I think, one of them I think of first is that one I talked about with the physician's assistant, where they were just going to, like, shrug their shoulders and keep walking away. You know what I mean?
Yep.
And so I think that's one where it was like, nope, keep doing the tests. Right. I think there have been a number of times when they, people, again, sort of not apathy, but advocacy when your person has a rare disease is even more complicated.
Yes. Because
we know more about this disease than most of his medical providers do. And so there have been times when they've said, I don't think we need that test. I don't think and that we have had to say, nope, like, he does. Actually, he does actually need those things. And so I feel like there's like too many examples to even, but it's just been a lot, or moments of them saying, we'll do this, but maybe next year. And I'm saying, no, I think we'll do this next week.
Right. Yeah.
And so I think a lot of it is about the urgency and pushing forward the urgency of those things.
Yeah. It's interesting. I think in recent times for myself, as you know, just been thrust into kind of a different level of care needed for my 82-year-old dad. And I think this episode is so critical, but I've seen even a change in myself in how to advocate and how important that is, where sometimes the hospitals or insurance, they will have their own agenda. And now being in healthcare, I realized, they have these metrics that may not be aligned with your wishes as a human being. And so, especially in my case, that's more like elder care, older, and you talk about worth. Sometimes they won't either do certain tests or go a certain plan because to them they're like, well, it's kind of at the end, are we going to really do that? Or it's on this metric of, well, that's too high risk of a death and that we get dinged on that. But what if the person is like, I'm willing to take that risk because I don't want to live that way for 10 years.
Right.
So without going all into the details of that it's like a complex thing. And I realized there's a whole element of advocacy where it's voicing the desires of the patient that may not medically make sense. But, you can keep him living, but in a way that he just really doesn't want to. It's complex, but it is that voicing of the desire, because all of this that we're talking about impacts the way we live and love and laugh and just function every day.
Absolutely.
And so we got to voice those things.
I think that's so powerful, Jess. And I think it's true that I see myself as Sean's voice often when we're in those settings, or even when we're here and we're dealing with insurance and whatnot, because I see part of my role as a caregiver is to try to make his life as easy as it can be. Like, he has got enough, right? And so I try to be there at every appointment and every procedure so that he can just lie there and be sliced and diced and all the things they're doing to him. And that's what he gets to be. And I can be the one to say, he looks pretty pale. I think we need a glass of juice. He's shivering. Can we get a blanket? I'll tell you what his med list is. Do you know what I mean? Yeah. And so in those ways, even so many times, especially if we're with a new provider and they say, Sean, tell us your story. He just looks towards me with these sad eyes, like, can you just, because his story is so long.
Yes.
And so in some ways I feel like I'm the voice in that way as well. Right. To try to lift that off, because if you imagine your dad at this point trying to advocate for himself, and that takes so much energy, as we both know, and that's not a place that we want them to spend their energy.
Right.
We want them to spend their energy healing, and not having to fight on their behalf. And so then we end up being the voice for them.
How has that impacted your relationship with Sean, being his advocate? Do you think it's gotten you stronger, or has it caused any tension in any surprising ways?
Yeah, that's a good question. I think there is a balance, right? Like, we want, I think doctors are trained to look not at the caregiver, but to look at the patient, say, tell me your story, right? And so he and I have had to work through that of I wait for him to say, will you just tell it? Or for me to say, would you like me to do this for you? And so I want to make sure that he doesn't ever feel like I am jumping in and saying, you don't have a voice. I'm just going to do all the talking for us. And so I try to make sure that there's a good sort of permission level there, because there might be some days that he does want to talk. Great.
Right. Yeah.
So I don't want to assume that he wants me to be the voice all the time. Yeah. So I think that has helped. And I think, for him to see the hoops that I am willing to jump through on his behalf. I think that has brought us closer together. And then for me to be, I feel like I'm so attuned to him and to his needs, has also certainly helped our relationship. I can see back in the day when things like parties happened, I could see across the room, okay, he needs to lie down. He needs to whatever. I'm super attuned to him because I'm used to watching for his needs and being able to advocate for them.
Yeah, having spent time with the two of you, that's what was so apparent, was that you are so attuned with each other. And so I can see, as you're talking about advocating, and I love the tension that you were talking about. It's you don't want to make him feel like he doesn't have a voice, because he has such a beautiful, amazing soul and voice. His poetry, oh my gosh, it's always gets me. It's amazing and so insightful. But I can definitely see that he probably feels so loved by you that, you know, probably, I don't know how much you debrief or I don't know how long and all the things that you've gone through, but I'm sure the doctor or someone says, hey, how's he doing? And you're like, say it all.
Right.
He's like, whoa, you're watching all of that? That's amazing. Yeah. Like, you must feel so loved. So that's another encouragement.
That actually happened yesterday with an appointment where I said, you know, can I just jump in for a second and tell you a couple things I've noticed. And I said, I've noticed that, like you said, his writing, he is an incredible writer. I said, I've noticed lately that you've been writing more. And that as you write, that really seems to be meeting a need and filling, you know, and then he was like, yes, it has. And then it sort of gave him the jumping off point. And so you're right. Exactly. That thing happened. That it was like, you could tell he was like, oh yeah, you have noticed that. Oh yeah. You know? So I think that has helped. I do want to go back for a second, if it's okay, like when I mentioned the party and you had said the thing about family.
Yes.
Because I think another piece of this, especially during the ongoing pandemic, is advocating with our friends and family.
What did that look like?
Oh, it is a daily battle. Fortunately, I will say the people that we most closely surround ourselves with totally get it.
Yeah.
And they've been with us since the beginning, and they've known he's immunocompromised since 10 years ago, right? And that's not everybody. And so it's been really, really hard. And I think that, you know, like for the first 2 weeks, March 2020, everybody was in it together. It's real great. Everybody was like, we should all be careful. And then it was like downhill.
Right.
And so it feels really lonely. Especially like at this moment where numbers are peaking again and like we're hunkered down again and we're making decisions about like, do we send our daughter to school and things like that. And it feels hard to have to justify our decisions to other people. And so even, you know, some great friends of ours texted, hey, do you want to come over this weekend? And that's just like not something that we were doing it for a while and now we're not doing it again. And having to decide, okay, do we say yes? Do we say yes as long as we all take a test first? Yes, as long as we mask? No, or, you know, and so, and fortunately it's an amazing friend who will understand in whatever way. But I will say that like there were some relatives that, you know, around holidays that we had to say, okay, we'll see you if.
Right.
We'll see you if everybody takes a test before we, and, you know, and I know that turned into a whole lot of, you know, behind the scenes conversations. And I just said, too bad. I'll be the bad guy. I will be the bad guy because I would rather, again, cause some angst in that moment, asking relatives to take a test than having him get it and end up being hospitalized.
Right. He's worth it. It's like that moment.
He's worth it.
He's worth it.
Yes. Or like being in public. And if you see, you know what I mean? Like that kind of thing. If you see somebody in public and they're whatever, you know, like standing up for him in those ways. And again, it's like, okay, me getting over this bump, this moment of like discomfort, saying it to the stranger or this family member is more important than him getting very, very sick later.
I mean, that type of advocacy could be even more complex because these are, right?
Yeah.
It's so fascinating as you're sharing. I'm realizing there are a lot of dynamics there. And then there's also long-term. Like there's one thing to advocate in front of a nurse who you may never see again or like after the 3 days. But like, that's fascinating. So like, are there any things that you really learned from that or takeaways? Like, is it better to be firm and clear up front? Or I don't know, does anything come to mind in terms of like, oh, make sure you do this when you advocate with your friends and family?
For sure. I'm super glad I did it. You know, like we made it through a whole Christmas trip and nobody got sick. So I feel really grateful that I did that. I think a couple things that I did was I said, like, we're all in this. So I modeled too. I said, we all, even though we've never left our house, we'll take a test too. You know, I had the test like shipped to people's doorsteps so that they couldn't say like, there's no tests around, you know, like I tried to make it as easy for people as possible so that I wasn't like putting them out necessarily. And I tried to say, we're all in this together. We'll take the tests too. But it just, I think doing that helped me, I don't know if anybody else, but it helped me be able to relax and enjoy that time with family. And I hope that like people were able to see like, it wasn't so bad, you know, it wasn't such a big deal. And so, yeah, I think I'm always sort of trying to paint the picture for folks about Sean. Like people love my Sean and he has, I don't know, a whole long list of the comorbidities that they say make him at super, super high risk of this. And so when people are, you know, making decisions about like what they should do or whatever, I just want to be like, just picture my Sean, you know? And I think that that's the thing too, personalizing it for folks. So it's not just like, I'm up here on this pedestal saying that I have this belief about this thing. It's like, I just care about this guy.
Right.
Humanize and so if you could also help me care about this guy by doing this test, that would be really helpful.
Yeah. Allison, who advocates for you? So as we were talking about, you know, you feel so seen and loved because Sean hears you understand and see all his moves and what's going on. Like, who does that for you?
I don't know.
I mean, that's such a true answer too, right? I mean, that's the hard part.
Right. I mean, I will say a couple things. One is that he, knock on wood, has been in a stable spot lately. And so he has been able to, when I've been like feeling unwell or whatever, having a hard day, he has really been able to step up and support me, which has been great. Nice. And I mean, we have this incredible, like my mom is 5 minutes away and my best friend is 15 minutes away. So we have incredible people around us who help, you know? I will say, and I'm not just saying this because it's your podcast, but like, I think that like all of you, right. And so you as individuals, but also just knowing like the app, right. The app is like my way that I can like wrangle the troops and say like, all right, I need it, you know? And so, and even just knowing that people like you and so many other great organizations are there trying to make caregivers' lives better, makes me feel better. You know, I'm part of this Caring Across Generations. I'm a fellow with them this year and they are just incredible. And, you know, just seeing that they are lobbying constantly on behalf of caregivers. So stuff like that just makes me feel like the big system is being worked on my behalf. You know what I mean? So
and
even
so
if it's
that
not
gives
someone
you,
individual.
Yeah, so that gives you comfort because you're like, I'm not doing this alone, even though that's great to hear. That's important. Yeah. So I mean, there's part of it of like, you know, somebody sending me a nice note or that kind of thing, right? There's an individual piece, but also like to know that systemically things are being worked on is like, okay, maybe it won't always be like this. Yes. Yeah. Right.
You know?
And you are a voice in that. So, you know, as we wrap this up, I want you to share with everybody just how you share your journey, your insights, your voice with everybody. I know, you know, just tell everybody where they can find you.
Yeah, thanks. So, you know, one thing I noticed in this whole thing is that caregivers are what I call in the negative space, which means like if you picture a piece of art, that there's the focus is on like the main picture, but so much is going on in the background of that picture. That's called the negative space in art. And if you removed that from your vision, the whole picture would change. But yet you never pay attention to it. You're always focusing on the thing in the middle. So I realized years ago that perfectly describes all of us as caregivers.
Right.
That we are in the background, that we are unseen, but this huge part of the picture. And if we went away, everything would change.
Oh, I love that.
So I recently, a few months ago, left my job in education to start a nonprofit called The Negative Space. And in this work, I am an advocate all day long for caregivers. And so I do that through writing just really honestly. I think that a lot of writing about caregiving is pretty sugar-coated. And so I would just write really honestly about what it really is like. Like you said, I'm on social media, and so trying to really like post and depict what it's like on a day-to-day basis to be a caregiver. I have my own podcast, the In Sickness podcast with Justin Baima, and we talk especially about being a quote young spousal caregiver, but we hit on topics that I think would support anybody. I do one-on-one coaching for caregivers so that they just have a space and a time to be with somebody who really gets it. I'm starting support groups coming up this winter. I do public speaking and webinars for people like Ayanna Care and other places. And so just really, and I'm also doing consulting with organizations like churches and other nonprofits to figure out how we can have culture change so that it's not just like I want to provide direct services to caregivers, and I don't want them to just feel supported when they're with me and benefiting from my services, but I want to, like, every place that those caregivers are walking into, whether that's their place of worship or their doctor's office or their insurance company or their Christmas party with their friends and family, I want them to feel seen and honored and supported. And so I'm working to get into all of those spaces to really have like culture change around what it is that caregiving is and what kind of support that caregivers need.
I love that. You guys have to just follow Allison and you will feel so connected and seen and fulfilled. And so I can't recommend it enough. I recommend you to everybody. Talk a little bit about your Caregiver Boxes.
Yeah. So I created these boxes, and the theme of the boxes is I am part of the story. Because I think that's something that caregivers don't often acknowledge or realize or let themselves acknowledge, that they're part of this story. And so that's the theme of the whole box. And so in it, caregivers receive a mug that says I'm part of the story. And I hear from so many caregivers that is what they reach for each morning, so that they have that reminder that as they go into their day that they're part of the story. There's a pair of socks from Note to Self socks that says I have a story. And I love it because you can wear those on surgery day or chemo day, and nobody knows that that's what's going on, but it's your own little mantra hiding under your shoes. There's a little tin of de-stress tea, and it's pocket size, so you can have it with you at the hospital. There's a meal bar, because we've all been in the space where you're in the ER and the cafeteria is closed and you made sure your person was fed, advocacy, but didn't make sure you were fed. So there's a meal bar. There's a little journal for taking notes at doctor's appointments and things. There's 3 aromatherapy little sticks that are pocket-sized in calm, comfort, and joy flavors, so that you can just get a little boost of that in between meetings, in between appointments. And then there's one of my favorite poems that I wrote. It's called Take Care of Yourself. And it's about what it really feels like when people are always saying, are you taking care of yourself? Right. And just kind of the reality of like, can I tell you what that really is like? So it's a whole, and then there's a letter in there for me as well. And so it's just a whole bundle of items that I feel like that I personally have seen myself and other caregivers need and use. Some that they'll use up right away, and others that hopefully they can hold on to and just have as a daily reminder that they are part of the story.
Yeah, I love it. I mean, you sent me one, and I'm excited to, share that we're going to be sponsoring a few of those for all of you. And so we'll have all the details of how you can get one of those boxes, because everything that Allison said, really, I was a recipient of all of that. And it is that boost. It's that boost that you're not alone in this, and that, I'm doing what I'm, supposed to be doing the best I can. And so thank you so much, Allison. Again, we could talk for hours.
We could.
And I just love you. I respect you. I'm so grateful for you. And I'm now so excited that everyone now knows who you are and that they can connect with you. And I would just end everything with, as we plead on behalf of the people that we care for, we just don't forget to advocate for yourself. And as we all said, that doesn't mean, that you have to be the expert, and that it means self-care, but it's just voice what you see, hear, and feel. And,
because your person's worth it.
Because your person's worth it. Perfect way to end it.
Yeah. Thank you so much. It's always a gift to be with you. Yes. So thank you for this opportunity.
Thank you.
Yeah. All right. Bye.
Bye.